And so what I'm looking for is someone who has had a hip injury, or who has had some pain in their hips or low back, and just in general doesn't feel so flexible. So is there anyone in here who would like to volunteer? So I saw Tisa come on up. Tisa had her hand up first. So tell me, Tisa, tell me, Tisa, what's going on?
I hurt my back several years ago falling downstairs.
Okay.
And ever since then, just a little, if I bend over too long, like weeding the garden or something, I can't stand up.
Okay. All right. So first thing that I'd like to do is to just take a look here. Is there any particular hip that bothers you more than the other?
No, it's usually...
It's pretty straight across.
Just in the back here.
Yeah.
Not so much in the front.
Okay, so let me just look at my note here for just a second, because I have a note to myself here. Yeah, we want to do this side. So let's have you put this side up. And whenever you put somebody in a sideline position, you always have them laying on their side and their head supported. So what we're going to do is bring the knees up. There we go. And so what we're going to do is just test your flexibility a little bit, because we want to just see just how flexible you are. Because if you're too flexible, I really want to show the class how this works. So just let your arm drop back to where it feels comfortable and not floating down. There you go. Okay, she'll do. All right, so there we go. So remember where her arm went? Did everybody remember that, where that was? Okay, so what we're going to do, Tisa, is bring your knees up just not too much, about right there. So Tisa, what I want you to do is, and please pay attention to how I'm dialoguing this as well, okay? What I want you to do, Tisa, is I want you to take this leg, and I want you to very gently slide it forward without pain. Do not go into any kind of discomfort or pain at all. And then now bring it back, and bring it back beyond neutral. Good. And I want you to keep this part still so that it's coming from down below. And you've been doing a good job with that. That's why I'm having my hand here, is to help keep you still. So now what we're going to do is, now that you know where we're moving to, what I want you to do is to very slowly bring the knee forward. Same movement. And then once you reach the end point, then start back the other way. And the same thing here. Once you reach the end point, start back the other way. Okay? Don't strain into the movement. Okay. Don't force anything. Just go as far as it feels comfortable and without a whole lot of work. Just notice where that happens. Okay? And again, let's slow it down a little bit on that coming forward piece. And what I want you to focus on and concentrate on is, can you feel the jerkiness that's in that movement as you're making it? Yeah. Okay, so what I want you to do is to very gently and easily see if you can smooth it out. Try to really focus and concentrate. And you're doing the coming forward part really fast. I want you to slow that down too. So it's like coming back nice and slowly, coming forward nice and slowly, and really smooth it out. There you go. And did you notice about a time or two ago that there was a little give in the movement? That was my signal that we'd already done enough. But for your edification, I wanted to dialogue how I work with her on this. Okay, so just rest now. And I'm going to hold her back into the same position that she was.
Wow.
Yeah, yeah. By opening up the SI joint, we changed what was going on with her whole nervous system, system-wide. And so so you can see how powerful these movements can be, is that what we did was we created space in the joint, and that allowed for her nervous system to calm down, and that allowed for her to increase the flexibility in her musculature. Okay, and it was simple, easy. It didn't feel like you were working too hard at all. Okay, and part of that is by bringing awareness into what we're doing as well, to help figure out what movements that we're working with, what muscles that we're moving. You can really see how this work can be powerful with what we're doing. Thank you so much,
wow,
Tisa.
Thank you.
Yeah. So this might be a movement that you might want to work with.
Yes.
Okay, and play with.
Excuse me.
Yes?
Movement for the shoulder or for the hip?
Well, it depended upon what our goal was. If she had a real severe shoulder injury to where she couldn't move her shoulder very well, that might be a good way to begin the process to calm down the nervous system, which would allow her shoulder. So it would be an indirect movement for the shoulder. It's a great question, Harold, because you're giving me an opportunity to talk about this, which I do talk about a little bit, but in the seminars. But so that would be an indirect movement for the shoulder. Okay. That would be a direct movement for the hip, because we're going right for the gold. We're going for what's going on in the hip and the SI joint, because what this movement does is that by dragging the leg forward, it drags the ilium and and opens the SI joint is what it does. Okay, so our focus was opening the SI joint on that movement.
You did this
Okay.
and nothing changed. What with her arm? What would that tell you is what I mean.
What it would tell me is that the issue is not necessarily in that SI joint.
Right. So if there was no if loosening the SI joint did not contribute to greater flexibility in the shoulder, it would tell you, guess I need to look somewhere else.
Yeah, and see, you notice that what I did was I looked at her first before I put her on the table. Again, you learn this in the posture class, because we don't have time to teach everything here, is I was looking at an anomaly called flare, okay, which is this kind of thing. And what I was looking for was which side is flared out, because if it was the flared inside, see how much stress there already is on that SI joint, then we wouldn't have gotten as good a results. Okay, but by doing the flared outside where I knew that there was going to be compression in that SI joint, then that by working that leg and opening that SI joint a little bit, I knew that I was going to make a difference. Okay, so it's understanding how posture ties into the body can affect how you give the movements and how you can make a difference in what's happening with people's lives. So, you know, just treating everything equally doesn't work.